All right. Hi, everyone. Thank you for coming to our monthly webinar series. My name is Phan from the Johns Hopkins Artificial Intelligence Technology Collaboratory for Aging Research. We have about an hour. I have about an hour with you. I would like to make today's webinar a little bit more informal, if possible. I mean, I have a presentation, of course, but there are two things I would like from you to just make this a little bit more interesting. I mean, you're spending your lunchtime with us, so I like you to feel like you are not wasting your time. If you have any questions, so the chat, because it's a webinar, the chat doesn't work. So you want to go to the Q&A button at the bottom and post your questions there. And so I'm going to try to monitor it and then stop as and when a question arises to answer it. The other thing you can do as well is you can raise your hand. If you raise your hand, I can unmute you, or Ann Wicker, who is the program manager with me, will unmute you, and you can just ask your question. And that's fine as well. And actually, I have a little exercise towards the end of this presentation, and I'm hoping to get participation because I'm trying to illustrate something for you. I won't tell you what it is, but I'm hoping that at the end of today's session, we'll sort of have a good idea of the kinds of things we have to think about in terms of asking the right question. So let me go ahead and share my screen first. Great. And you should be able to see this. Asking the right question. So today I'm going to talk about this sort of interesting aspect that of your commercialization journey, right? Those of us who are investigators, scientists, clinicians are very much sort of focused on trying to solve a problem within our own domain of expertise, whether it's in the lab, whether it's in a clinic. And so we come up with a solution. And then when we try to commercialize the solution, we're oftentimes then looking for how to use that solution, deploy that solution against a problem that we're trying to identify. So it's a little bit like, having a hammer and then trying to figure out everything else that looks somewhat like a nail, right? So you're going to find that in your commercialization journey, right? You have a foundational model, you have a device, you have a molecular target, what have you. And then you're sort of looking now with a molecular target, presumably you have a hypothesis about why it works and all that and what the intervention ought to be. So that's a little bit clearer. But oftentimes, if you have a device and then you're looking for something to apply it to, you run into this situation where trying to identify a set of users can be a little bit challenging. Even more difficult if you're trying to generalize the application of your algorithm or your device or your care model to a wider audience, then you really get into difficulty sometimes trying to define what that target market is going to look like. So instead of doing it that way, which is sort of technology forward, I'm going to talk about how we take the opposite approach. I'm not suggesting that you give up on your technology or give up on your idea. What I'm suggesting is somewhere along your commercialization journey, it's worthwhile taking a step back sooner rather than later and think about the unmet need or the problem that you're actually trying to solve and doing it from a different perspective. Okay, so that's the purpose of today's webinar, which is to ask the right question with respect to the problems you're trying to solve in the ADRD and/or healthy aging space. And the net result of doing that is the ability to write an unmet needs statement. Now, some of you may have already gone through an exercise like that, but I think writing a good unmet needs statement does take practice, right? It's not something that you automatically will be able to do easily right off the bat. So I'm going to start with this quote, which I found probably one of the most insightful ways to look at, how we could start from the problem rather than from the solution or from the tool, right? So this is a quote by Theodore Levitt, who is, a well-known marketing professor at the Harvard Business School. Um, and there are sort of different variations of a quote like that, but this one I thought sort of brings it, I think, to a sharp focus, which is that people don't want to buy a quarter-inch drill. What they want is a quarter-inch hole. So think about that a little bit. Okay, I mean, if you go to Home Depot, you're buying tools, right? So we tend to think of what we're trying to do as developing a tool and then selling the tool. But what we're really trying to do is we're trying to sell a solution, right? So, when I go to Home Depot and I'm looking for a drill, I'm not necessarily interested in the drill per se. I mean, I need the drill because the drill helps me get something done, get a job done. And the job is creating a hole. Now, is the drill the only way to create a hole? No. I mean, there are many ways of creating holes, and it depends on what kind of material you want to create a hole in, how big of a hole, etc. Right? You can create a hole with a saw. You can even create a hole with a sledgehammer. Depending on what kind of hole you want. So the drill is simply the tool, the instrument to get a job done. And so when we talk about understanding the unmet need statement, what we're trying to get towards is understanding the job that needs to be done by that stakeholder, the customer, the patient, the clinician, etc., to solve the problem. And so it's understanding the problem, right? So the first step is to understand the problem. And so those of us who are engaged in this journey of commercialization that oftentimes have our heads very much deep into the experiments, into hypothesis testing, etc., it's worthwhile, as I said, to sort of take a step back and from time to time try to re-articulate the problem we're trying to solve. And it's useful for two reasons. Number one, it clarifies whether we're in fact going in the right direction or whether we need to pivot. Because, as an entrepreneur, as a technologist, pivoting is one of the skills that you really need to know since technology changes, needs change, institutional environments change, the law changes, especially in the healthcare space, the kinds of things that impinge upon our ability to get things done is always changing. And what that oftentimes means is that, the problem definition has to be re-looked at. And you might have to tweak the problem definition again, in order to adapt to what's been changing on the outside in the external environment for which you have no control, right? The government, the regulators decide, well, we are now going to try to deprioritize animal testing and instead use models that we know work, and support that and incentivize that. Well, you got to go back to your experiments and say, well, is there something I can do to adapt to that, to that changing environment? There may or may not be, but you don't sort of just proceed, without recognizing that your environment may have just shifted a little bit or a lot. So naming the problem is the first step, and naming the problem actually does take practice. And we go through a bit of an exercise afterwards to try, to get you to think about the problem you're solving and then try to sharpen it a little bit more so that you can name it very precisely. And the reason you want to be able to name your problem very precisely is because you want to get to the root cause of the problem. You want to understand the etiology of the problem. Like even diseases, right? So, we are all very hot right now on these GLP-1 agonists and, all of the related, pathways that are associated with that. But the thing is, and by the way, the fact that we are still continuing to discover sort of new things that these pathways seem to be affecting, in the metabolic system is sort of interesting, right? Because obviously we haven't totally understood the science behind it. I mean, we are sort of finding it out sometimes by trial and error. Okay. So I think naming the problem precisely and renaming it and continuing to work on that, even as you're working on your solution, is important because it helps you sharpen your understanding of the root causes. Some of it is just science. A lot of it is actually understanding the environment in which these problems occur. So that's the context, right? So the box on the right-hand side is, when does this problem occur? So problems could be episodic. The problem you're dealing with could be episodic. It could depend on the geographic location where it occurs. It could depend on there could be seasonality patterns attached to the problem. So again, looking at the context and taking it apart and saying, does this thing have certain patterns, right? Can we detect certain patterns in which the problems are quiescent, or the problems are more acute, right? Even chronic problems go through cycles of quiet and flares. Some chronic problems do, right? So metabolic problems are oftentimes have that pattern. So we want to understand that, and it's also important to understand that that there could be sort of biological etiologies for the pattern of occurrence of problems, but biology, as you well know, doesn't operate sort of independent of its environment, right? So there could be circumstances, environmental circumstances, locational circumstances, weather-related circumstances, et cetera, that could interact with the underlying biology. And it's also important to understand that, because if you understand that, then you get a little bit closer to sort of root causes, not only of the problem in general, but the problem when it is more or less acute. Okay. So now, once you sort of have that, laid out clearly, then you want to also understand who has that problem. Not everybody has the problem, or the problem may be more severe for certain people than others, right? And the reason we know that is because that you will find that within your target population that reports having a particular problem, and I don't mean just a disease, it could be an inconvenience, right? It could be problem related to the way care is given, to the way diagnosis, accurate diagnosis is achieved. For some subsegment of that population that reports the problem, it's not as important as for other segments. And so one of the solutions to the problem that you will always have to deal with is the non-solution, meaning the decision not to consume, right? The decision not to solve the problem. And the reason why patients and consumers and providers might decide that they want to not deal with the problem is because there are other problems to deal with, right? If you think about how people make decisions, right? We don't make decisions as consumers in a vacuum. Typically, we make decisions as a series of trade-offs, right? And the reason you have to make decisions as a series of trade-offs is because you have limited resources. You have limited money, limited time, limited attention, limited energy. Okay. And so this budget that you have, you can generally call it the energy budget, which includes everything that I talked about. You have to figure out how to deploy in order to achieve the best possible outcomes, the highest quality of life given the circumstances. And so there are going to be problems, or going to be concerns that you might articulate, but don't rise up to the point where you're willing to give up dealing with something else in order to deal with this. So part of your understanding of your target market, of who to focus on, right, is going to also understand that part of the market for whom this particular problem, presents itself, but is not serious enough to be dealt with. And that could represent a secondary market if you come up with a solution that maybe lowers the cost of adoption or makes it more convenient. You sort of change a little bit the decision matrix, right, for that particular group of individuals. They can be a secondary market, but it's important to understand who they are. And why do I say all that? I say all that because your target market is not one homogeneous, a group of individuals. Understanding your users, their personas, the demographics, the user phenotypes is really important, because you are trying, at least in the first instance, right, to develop a solution to solve a problem for whom this problem is most present, is most important to be solved, because this is the group that are most willing to give up resources, right, to get that problem solved. So you want to see to whom is this pain the most acute, because that's going to be your first customers. All right, so I'm going to stop here a little bit and sort of go through some. I received some questions. Do you have an email or contact info for follow-up? Yeah, and you can actually reach out to Ann Wicker. And I think my email is also on the Johns Hopkins website, so you could go there. Um, oh, I'm actually allowed to type an answer. Here we go. Sorry about that. So if you go to, right. So Diva says, what about the same metabolic problems which have been observed for a long period of time? Yeah, I mean, that's sort of an interesting question, right? Because there are very few problems that we are encountering, that we are dealing with, for which we're looking for solutions that are completely novel to the world. I mean, some problems may be emerging or emergent, but there are a lot of problems that we are trying to solve, especially in the aging space. When you're talking about ADRD, I mean, how long have we been trying to find appropriate targets, for drugs? Or how long have we been trying to figure out how to detect early on, pre-symptomatic onset of early dementia or mild cognitive impairment? I mean, these things have been around for a long time. We just haven't gotten necessarily to an understanding of the etiology of the problem. Like, do we know what are the etiologies of mild cognitive impairment? I mean, it's multifactorial, right? And depending on which factor you focus on and how you want to detect it and how you characterize it will get you closer or further away from early detection. But detection is only half the story. Now what do you do with it? Right. And there are all kinds of questions about, well, what if you are able to diagnose something even with a high degree of accuracy, but there's no remediation, right? There's nothing you can do to intervene or even slow or even ameliorate what do you do with that? So there are all these sort of questions that come up, and which is why going through something like the problem statement canvas is really important, because maybe for some subsegment of the population, even though the problem exists, it's not something that they necessarily want, need, or have to solve at a particular point in time. Right? What about problems that weren't previously solvable before your solution? Yeah, well, technology changes all the time, right? So, that's why it's worthwhile going back to the problem and restating the problem, because, especially if we're looking at something like artificial intelligence technology or general AI, let's say, literally every month there's a new development. If you go into any of these foundational model, I call them app stores now. ChatGPT is an app store, Perplexity is an app store. People are developing applications on top of these foundational models. I mean, these stores are growing exponentially. Okay, so the ability to solve a problem in a more precise and a more exquisite way also improves over time. That's just the nature of the interaction between the problem, which may be quite old, quite static, maybe not very well characterized, or maybe very well characterized, but for which instrumentation for measurement or therapeutic interventions are not yet available because the technology is not yet available. mRNA is a good example, right? I mean, the most famous application of mRNA, of course, was the COVID-19 vaccine. But actually, mRNA technologies has existed for 10 years, well before the COVID-19 vaccine. It was that particular event that catapulted that technology, into prominence because of just huge investments into trying to make it work very well. And now, of course, that technology has broken open all kinds of possibilities, and we're thinking of vaccines in domains that we don't even necessarily have thought they would represent a reasonable therapeutic solution. Okay, so all right, so let me keep going. Keep your questions coming, and I'll try to be respectful of the time. So now, when we talk about customers, there are two levels at which you can talk about your target market. Obviously, the market as this group of individuals with similar, expressions of the problem, similar concerns about trying to solve the problem, to get the job done, so to speak, right? To create that half-inch hole or the quarter-inch hole. But you also need to talk about your customers at the individual level of analysis, okay? Because even within this group of in the target market is variation. And so one way to get to that, because ultimately we are dealing with individuals, even though a lot of our solutions, if they are to work well, really ought to work for a population. But nonetheless, within the population are individuals. So, I always ask innovators to think about how their users, when you create a user persona, how do they feel about this problem in their lives? Sort of related to the earlier point I made, which is for some people, they don't feel bothered too much by it. It doesn't mean the problem doesn't exist. I mean, a good example is traffic, right? We all are very familiar with the inconveniences and the irritation that, large city traffic, busy city traffic and poorly planned roads pose for our lives. For some of us, it's actually quite crippling. We spend 1, 2, 3 hours on the road, each day. That's a third of the workday gone just sitting in traffic. For some of us, traffic is an irritation, but it doesn't necessarily represent a problem that absolutely needs to be solved by decisions that we have to make in our lives. And then, of course, after the acceptability of work from home and Zoom meetings and things like that, the traffic problem for certain parts of the population become less and less important. For others, it continues to be important, right? If you have to be, present in person, in the workplace. So emotional impact matters because, we don't make decisions necessarily, just on the basis of just, automatic trade-offs. We do make decisions based on how the outcomes or the problem makes us feel, right? So again, the more pain we feel, whether it's emotional or physical pain, the more likely we're going to pay attention to the problem. And then, of course, it's always important to quantify the impact, of a problem. And that's probably one of the more difficult parts of, doing a market analysis, of doing your problem statement canvas, right? Which is, can we quantify the impact? So if we're talking about traffic, how many hours of, unproductive time does it cost us, on a daily basis, a weekly, a monthly, or annual basis? How much of our lives are spent, and what does that represent, either in terms of economic impact, in terms of stress and anxiety, in terms of missed opportunities for other things that are important for us in our lives. So that's a very simple, but it is a very vexing example. If you're talking about older adults, okay, what are they giving up, right? What else are they having to give up in terms of their life in order to deal with this problem that is unsolved or incompletely solved or not solvable at this point in time? And understanding that is going to be important. Why? Because the more impact, the higher the quantification of the impact, right, on a person's life, the more likely they will want to solve the problem, the more likely they're willing to pay for the problem to be solved, the more likely that those who are supporting them are willing to pay for the problem to be solved. Because ultimately, that's what we're talking about here, right? Building a solution that solves a problem, is great. Building a solution that solves a problem for the market, the group of consumers for whom the problem is most important is best, because they are going to be your most loyal customers. They are the ones that will, be willing to try your alpha product. They are the ones that will co-create with you. They're willing to invest, right, with you in order to make the solution work for them. So identifying, the subset of users for whom this is particularly meaningful is quite important. It's going to be part of your commercialization journey. Now, how are your customers, or what are your customers doing now to fix the problem, right? So especially for long-standing problems that we're trying to solve, these problems, especially if they've existed for a long time, are going to motivate creative ways of mitigating them. Again, one option always is you don't deal with it. That's an option. That's always an option. And that's the option that you have to at least compare your solution to, which is your solution better than not doing anything about the problem? right? I always tell innovators, I say, look, you might have developed something that you think is the best thing since sliced bread, but understand that there is going to be a group of people for whom your solution is not a good fit, is not important, is not meaningful. You have to understand why, because that's what you're competing against. Okay. Ultimately, that's what you're going to compete against, especially if you're trying to build a stable, growing enterprise. And then, in together with answering that question, of course, the natural follow-up is, well, what are the disadvantages of these alternatives? So, people are trying to solve the problem now, but there are disadvantages. Why do you want to know that? Because presumably your solution is ultimately, when you design the solution, it needs to address those disadvantages of the alternatives, right? So never design your solution sort of in a vacuum. You might think that you found, a great scientific answer, right, to the hypothesis, the scientific question. But when you try to translate that into an actual solution that can be used, you have to do it and that's the nature of translation, as opposed to just pure discovery, is you have to do it in the context of how is it actually better than an existing alternative, right? So beyond, verifying or disproving the hypothesis, when you translate your discovery into something that could actually be used, you always have to do that in the context of, well, is this any better, or does it actually address the shortcomings of the existing solutions that are out there? So that's a problem statement canvas. And what you have to do actually is you don't answer these questions once. You do it iteratively, because guess what? Once you are done with answering the last two questions, which is what are the alternatives, what are customers doing right now to solving the problem that they're currently dealing with, and what are the disadvantages, you go back and you look at the problem and say again, okay, in the light of what is possible right now, have I defined the problem accurately? Or have I defined a problem in a way that allows me to better articulate the value of my solution, right? So you cycle back. Now, the answer might be, yeah, I'm happy with that. It still works. Great. Then you proceed. But you might find sometimes that when you cycle back to the problem, you say, well, maybe I've defined the problem too generally. Because if I define the problem this way, it turns out that there are a whole bunch of solutions which are perfectly fine in the marketplace right now. There's some disadvantages, but nothing to suggest that my solution is any better than the alternatives that are out there. So what that means is I have to redefine the problem. I might have to narrow it. I may have to sharpen it. I may have to think about how the problem presents to a different population, or to a even smaller segment of the target population that I originally identified. You know what I'm saying? So it's sort of a dance, so to speak, right? You define the problem, you look at the solutions that are out there, you go back and redefine the problem until you can define it in such a way that your solution is the best fit to solving that problem. Now you have a way to proceed forward with what you're working on. All right. So let me see. Let's see. Has anybody raised their hands? Because I think I heard a blip, but for some reason I'm not able to see that on my screen. No. Okay, this is good. So I'm going to continue. So are there any questions right now on this piece of it? I know I'm spending a lot of time on it, but this is actually fairly critical. And I'll tell you why. In the AITC, so this is a webinar for the AITC, right? So we have received over the last 5 years hundreds of project ideas, pilot project applications. We fund a number of them. But one of the things that we oftentimes pick out is this sort of lack of precision in the definition of the problem. And again, I'll illustrate it in my final exercise afterwards, right? It's a typical sort of problem statement that we get. And we're always asking the question, what are you actually talking about, right? If it's too general, it's not very useful in helping us, at least the evaluators, and certainly if we're a customer, it's not very helpful in helping us evaluate how good of your proposed solution is. Okay, let me keep going down. Okay, so here are a few more questions before I go on to the next. How do we share a problem so that it makes a case and reaches more people and involves it? Yeah, I wouldn't necessarily. So, so if I'm going to understand the question more precisely, I think the question about how to share a problem is how do you articulate a problem so it makes a convincing case? And that's actually going to be the next couple of slides, right? Because right now, if you're just talking about problems in general, no one's going to be necessarily convinced because we have all heard about these problems before, right? Early detection of mild cognitive impairment, ADRD, diagnostic tests for movement disorders, et cetera, right? Better care coordination post-discharge, from surgery, so on and so. These things we've heard before. So if you're simply saying that, typically the reaction you're going to get is, well, yeah, so yeah, we know, right? So what is it unique about your problem statement that gets us, that is compelling enough for us to then ask the next question, which is, oh, that's interesting. Tell us a bit more about your solution. Okay. So that's what you want to get at. Um, so the question is, how do have you heard? Okay, so Alex is asking a fairly technical question about two different programs. These are programmatic questions. So if you want, Alex, maybe you can email me that question, and then I'll get it to someone who can ask. I mean, these are programmatic questions which are not directly related to the talk today, but it's a good question. I will tell you that the NIA is funding a lot of these collaborative type grant programs because they have understood, I think rightly so, that the solution to the diseases related to aging, as well as healthy aging, as well as the ability to age, at home, etc., is multidisciplinary. The causes are multifactorial. And so the only way you can solve these problems is that you have to get lots of people from different disciplines, different domains, talking to one another, focus on solving the one thing. So all of these programs that you're referring to, whether it's AI for AD, whether it's something like the AITC, they're coming up with a massive database for AD that they're funded, and then presumably it's going to power a lot of new searches for etiologies of the disease, molecular pathways, and so on and so forth. For alternative shortcomings from Daniel Byrne, what do you think about performing a pragmatic randomized control trial of care versus? Yeah, so all that occurs. So what you're talking about is the step in the at least the proof of concept, if not the proof of value, right? So I'm talking about the step even before that, which is articulating what problem you're trying to solve. Once you have a problem that you're trying to solve and you have it well defined, then yeah, absolutely, design your intervention in a way that you can collect data so you can definitively conclude if the intervention works or not. So of course, the gold standard is your RCT, right? Or at least a pseudo RCT, which is something like an intervention group and a match a sample or a match case, a control, a pseudo control or something like that. So I mean, all of these things are important. But what I'm suggesting in the webinar today is before you even get to designing an intervention, just understand precisely what problem you're solving, who has the problem, for whom this problem is most acute, and therefore for whom the problem needs to be solved, right? As opposed to just a problem to be solved. I think that's really, the point. How do you define precision in that case? Well, precision all has to do with have you clearly identified, the target, for whom the problem is most acute and for whom this target is willing, to expend resources to solve it. That's going to be part of doing market research. And by the way, again, this is actually iterative. So you can define a problem a certain way, go after, do a survey, do focus groups, with potential potential patients or users, potential audiences, for that problem, and then come back and discover that maybe that's not the right audience, that's not the right market, that's not the right subpopulation, and then you go back and redefine the problem more precisely. So you do this iteratively until you get to quote unquote precision, and precision is I now have articulated a problem for whom I have a clearly identified group of individuals, right? That the problem presents, not just presents, but presents most acutely, and for whom this is on the top of the list to solve, right? When you get to that point, then I would argue you actually have a fairly precise definition of the problem. That's when you can sort of start thinking, is the solution I'm working at right now, does it fit? Right? Or do I have to go out and adapt my solution, or do I have to develop a new solution? Right? If in fact that is the intent. And it's iterative, right? I mean, don't think of this as simply a linear process. When do you bring the customer into the problem statement analysis? The customer comes in very early. And the customer could basically start with a hypothesis, So I need, there is a problem right now in being able to detect pre-symptomatic mild cognitive impairment, right? It exists. And there are a bunch of ways of doing that. And, LLMs, with detection of speech patterns and all that is one way to do it. We're still not there yet, right? So that's like a general problem. The next step is, well, for whom is this, MCI particularly important, because MCI progresses, more acutely to, let's say, AD or ADRD, early on in life. Okay, so now there is research that already exists, perhaps of the subgroup or a certain phenotype earlier on in life, that if we can somehow detect pre-symptomatic MCI, that we can maybe intervene, okay, to slow down the progression to AD for this particular subgroup. So you want to bring the customer in as early as possible. A customer, by the way, when I use the word customer, typically when we think of customer, we're thinking of purchasers, but a customer could be a patient, right, that is covered by insurance. So someone is paying for it, but this is the group, the audience for whom the problem exists that needs a solution for. So that's what I mean when I use the word customer. Okay, it's more general than simply that individual that is actually paying. Now, that individual might also pay. You might find that there are some groups within your population that are willing to self-pay for your solution if it's important enough to them. Okay, so I'm going to skip the next one, define a startup NIA grant. Again, that's a programmatic question. You can email us those kinds of questions and we're happy to answer it. All right, so time is moving. I want to move on to the next one. So now, once we have the problem and we have an understanding of the customer, meaning what we just talked about, you then derive an unmet needs statement. So here is an unmet needs statement. It is articulated in a very specific format. And I'll explain why you need to articulate it in this very specific format, right? So the unmet needs statement is simply this. It's a way to address a problem for a market segment that results in the desired outcome. So there are 4 elements to it, but for the purposes of articulating the unmet needs statement, you can ignore the first piece. The first piece, the way, is the solution, right? A way, a method, an intervention, a therapy, etc. You can fill in the blank there, but don't worry about that for now, because the translation between your problem statement canvas to the unmet needs statement is the next 3 bolded terms. The problem itself, so articulate the problem, the target for the problem, the market segment, and the last piece, which I didn't yet talk about, but which is sort of implied in the problem statement canvas, which is the desired outcome, right? So the desired outcome is the fix for the problem for that market segment or for that population for whom, that presents with this problem. And if it's fixed, this is what they will look like. This is how their life will look like, right? So you always think in terms of the problem and what a fix of the problem will result in terms of an outcome, right? If it doesn't result in a desired outcome, then it's not really a problem, right? Because if you fix the problem for this particular subsegment, for this particular population, and they don't get the desired outcome that they want, then either it's the wrong population or it's the wrong problem, or you haven't defined the problem correctly. So let me give you a really good example. And this actually comes out of our biomedical engineering program. at Hopkins. And this has nothing to do with, with aging, although, open heart chamber reshaping or surgical ventricular restoration could also occur for older adults. But I'm deliberately picking this example, and then we'll deal with an aging problem later on. All right. So let me read this out to you, and then I want you to sort of just think a little bit about this. All right. So here is an unmet need statement. It's very, very precise. A method to perform surgical ventricular restoration for patients presenting with hypertensive cardiomyopathy without the need for cardiopulmonary bypass to reduce complications and speed recovery time. Right. So now typically with open heart surgery, you sort of, in order to do the surgery, you have to stop the heart, put a patient on a heart-lung machine or an ECMO, do the surgery, restart the heart, close up. Now, here's the thing. A bypass is a separate procedure, right? It's not technically the procedure to fix the heart valve or the heart, the left ventricle, right? The heart chamber. But you have to do that piece in order to get to the actual fixing of the heart. The problem is, as you know, some of you already know this, that if you stop a heart and you put it on a bypass, that it actually complicates recovery, right? The stopping of the heart is very difficult. I mean, that in of itself is not just invasive, it's very traumatic. And then the restarting of that heart. So you can sort of imagine how just to do one thing, which is to ablate the thickened walls in the chamber, you have to do all these other things just to get there. So that's a problem. And it's a problem for a particular set of patients that need this procedure done. It's also a problem for the surgeons that want to do this procedure and do it in a way that's not just safe, but actually, maximizes recovery time, minimizes complications, etc. Right? So they're looking for a way to basically do open heart surgery without stopping the heart. That's a thorny problem. But guess what? If you can solve that problem, so you invent a device, you invent a procedure, you invent, some kind of a therapeutic intervention or a pre-surgical intervention that allows you to do that. Maybe it's a robot, I don't know, but whatever it is, if you can do that, guess what? You have just made what is a very high-risk procedure because of these adjuvant procedures, interventions that have to happen. You have just significantly lowered the risk of this very high-risk procedure, right? So that's your desired outcome. So when you think about the project you're working on and coming up with an unmet needs statement, this is the level of precision. Remember, there were some questions about precision. This is precise. It's precise because it articulates the problem in a very specific way. It articulates who has the problem, why the problem occurs, because you have to do the procedure and you're going to do these additional things to get that procedure done. And it also tells you, if you solve that problem, what kind of an outcome you should expect to receive, to achieve, right? Lower complications, faster recovery rate, happier patients, living patients, et cetera, et cetera, et cetera. Very, very precise. So that's the degree of precision that you should be driving at when you're stating an unmet need. Because right off the bat, if you know this is the job to be done, remember I said you start with, you want a 1/4 inch hole. Well, this is the 1/4 inch hole. This is what I need. Now, how am I going to get a 1/4 inch hole? That immediately opens up all kinds of potential possibilities. So you don't start with, oh, I got to change the way I do open heart surgery. Or you don't start with, oh, I need a robot, or I need a different set of, surgical instruments, or, etc. You don't start there, right? What you start with is articulating this. Then you go back and you say, all right, how am I going to get this? There are different ways of doing this, right? So that's the unmet need statement. An example of an unmet statement. Every problem should be subject to this kind of an exercise and sort of inquiry of your problem statement canvas till you can come to this one statement. It's typically stated in one sentence. The shorter, the better. The more precise, the better, right? Or rather than the word precise, maybe I should use the word specific. You're referring to very specific things. All right. So here's that brief exercise that I want you to, in our remaining time. Here is a typical unmet need statement that we get. In fact, if it even gets to this point, it's great. We oftentimes don't even get this, right? We typically, it starts with the aims and then it immediately goes to here's our solution, here's our technology, which is fine. The program that we are running is providing resources to pilot tests or to develop in a pilot fashion, a technology to solve a problem. But before you get to the technology, please, tell us what your problem is in a very precise way. So here is a typical unmet need statement, right? A method to continuously, so again, see the structure, right? A method to continuously and accurately detect cognitive decline to personalize care and delay the progression to dementia. All right. So let me take some of not a vote, but let me just ask you what is missing in this unmet needs statement. You can type it in the Q&A, or you can simply raise your hands, and I'm going to monitor this and see if anybody raise their hands, or you can unmute yourself. Okay, so I have some questions here. The solution. Yeah, but remember, in an unmet needs statement, you're not talking about a solution, right? So you don't want to talk about solution, at least at this point. Obviously, ultimately, you got to get to a solution. But at this point, you don't want to deal with the solution. You just want to articulate the problem, right? So there's another one response here for who. Yeah, for who. The approach, the team. Okay, all that comes after your unmet needs statement. Once you have nailed that down, you can talk about how are you going to solve the problem, who are you going to solve it with, who else has, a potential solution to the problem, why are they better, worse than you, etc. Right? So remember, this is just the beginning of your commercialization journey. Okay. So what else? Seems too general. Age range can make a difference. Yeah. So for who, right? For who and how. I would leave the how out for now. That's the method. That's why I say, in the previous statement, let's not worry about the way at this point. Now, ultimately, you will want to put in the way, the method. So absolutely, because that's what we're about. We're about developing solutions. But for the first version of this, keep your mind open about the way you're going to solve the problem. Okay, and that's a challenge for those of us who are used to, finding solutions, right? Because we develop the tool that we're most familiar with, right? I have a hammer, everything looks like a nail. And it might well be that everything looks like a nail, but let's not go there yet. So the type of dementia, right? So I've got some very nice sort of suggestions on improving. So yes, putting in there somewhere, who is the target, right? Is there a certain phenotype you want to focus on? Younger people, active people, so you might say, maybe there is a subpopulation of people that we don't expect to have, early signs of cognitive impairment, right? Or that we don't expect to have cognitive decline, and yet we find it. Okay, so the science, the studies, the epidemiological studies tell us that for some strange reason there's this group of people we don't expect them. Maybe they're young, they're active, etc., but they're displaying these early onset symptoms. So you want to target that. So whatever it is, whatever mystery you're trying to solve, make sure you articulate who it is you're solving for. Or maybe it's just people approaching early the early part of the older adult category, approaching 50s, or maybe women, or maybe premenopausal women, etc. So be very, very precise, because your solution is going to be driven by the way you define the problem. Okay. Then what happens with the late diagnosis of dementia? So the type of dementia, yeah, because there are all kinds of dementia, right? What happens to late diagnosis of dementia? Well, that could be another variation of the unmet needs statement. So now we are concerned about late diagnosis of dementia, right? So early diagnosis maybe allows us to do some intervention to delay progression. Okay. What else? A quantifiable measure of how you're going to solve the problem. Okay, so the quantifiable measure I think is interesting because you can put it in there, which is that so that would be part of sort of like the outcome, right? So if you solve the problem, um, can you delay progression or can you maybe diagnose a decade before? Right. So you can be bold. You could say, based on our benchtop work, based on the science that we have today, if we can detect pre-symptomatic, mild cognitive impairment that progresses to dementia 10 years before, there are things that we can actually do that prevent even progression, right? So there could be science to support that. So if that's the case, then yeah, definitely quantify that. So now if you do that, guess what? Now you're looking for a solution very precisely, and you're testing your solution against this benchmark, which is I need to be able to detect 10 years ahead of time. Now, how you get there, the experiments you have to design, because it's 10 years, it's a little bit, more complicated. You might have to simulate it. It's sort of difficult to design an experiment in which you have to wait 10 years to see the results. But there are ways of doing it, I think, statistically. But the point is that the more precise you are, the more exquisite I think you can design your solution. And that's like really, really helpful, really useful, right? So I've got a few other contributions. For whom is this an acute motivating problem? Yeah, right. I mean, let's say that a large percentage of the population will experience cognitive decline. Now, there is some subsegment of the population for whom cognitive decline or early cognitive decline is particularly vexing, is particularly important to solve. I'm not saying that the others are not important, but if you're trying to figure out a solution for the most acute need, well, maybe people who are still in the workforce, people who are still employed, people who are still making an income and supporting a family. So now you're getting, again, looking at a subsegment of the population for whom, if you can design an early diagnostic tool, they will be the first ones to jump on board. And by the way, guess what? If you can do this, can you imagine how much easier it would be to recruit subjects to test your solution, right? If you can precisely identify, that part of the population for whom this is particularly important, and offer them the possibility, with the usual, ethics approvals and all that, that's by definition, right? But, so now you've also identified a potential partner in the development of your solution. That's a great thing because we know one of the biggest problems with developing interventions in healthcare, and especially in something like, a sort of a disease with a long pathway, is finding appropriate subjects, right? And getting people, to volunteer. How it fits into current practice, how it can improve clinical workflow in practice. That is the solution. That's the design of the solution. So there are a set of other questions that you want to ask, which maybe I'll do a webinar on this, which is what are the questions you need to ask when you're designing the solution. Now that you have a good unmet needs statement and you want to design the solution, what do you do with that? Well, things like how does it fit into clinical practice is so critical, because the one thing we know is given the workload and the amount of basically, the labor force challenges, especially in the aging space, you don't need to add more work, right, to doctors and nurses and allied health professionals. You need to reduce work. So your solution needs to at least address that. That's sort of, an important, but not necessarily the primary target. Or it could be the primary target, depending on the solution you're developing, right? If it's a care coordination tool, for example, a lot of times care coordination benefits the patient, obviously, but it also benefits the providers and the provider organizations by making it more efficient, less costly to deploy, etc. Right? What happens if it's not gender specific? Well, I mean, it may or may not be gender specific. I don't know, right? I mean, the science will guide you on that. For some problems, they may occur more frequently among a particular gender, and maybe that's the target group for your solution because it's more vexing, right? It's more costly if the problem is not solved correctly. For some problems, it's non-gender specific, in which case, why do you care, right? It might be specific to other things, age groups, where people live. The other thing too is that maybe this is a particularly important issue for people who live in rural areas or areas where care, dementia care is inconvenient or it's not so easy to get. So if you can detect a pre-symptomatic onset of decline early, you can get them to care because you're not you could sort of surmount the fragmentation of care problem or the distance to care problem, right? Earlier on, you can plan better. So, there might be subpopulations for whom this is particularly important because of the next step, which is actually providing the care. So if you know early, you can plan earlier. All right. So thank you for your contribution. And I think that's all I wanted to sort of say today. And I'm just going to end with this. The unmet needs statement is actually core to the commercialization journey. And I hope I've convinced you. The reason is because by articulating that clearly, you articulate your target market. So who are you designing the solution for? And when that market changes, your solution is going to have to be adjusted, right? It's going to define your technology development pathway. It's going to tell you what features are going to be valued and what features are going to be less important. What goes into version 2, 3, 4, 5, right, of your product, right? Version 1 is your minimal viable product. That's the version that has all the features that are needed in order to serve your most critical customer. And then as you expand your market, as you generalize it, you add more features to it. But that's your sort of longer term technology development pathway. It determines your revenue and financial model. Who is most likely to pay for it? How much? How often? Right? Is this group growing or shrinking? It's going to determine your go-to-market strategy, which is related to your financial model, and it's going to also determine your exit options. How costly will it be to develop a solution? To bring it to market. Do you want to do it on your own? You want to take a strategic partner? Do you want to sell the intellectual property to a large, pharma company or device company or a hospital system or an insurance payer, right? So there are many ways once you have sort of the sketch of your solution to solve this need to exit or to go forward. And then, of course, together with exit, you've got your growth options. How are you going to grow? Do you simply continue serving your target customer? Do you generalize it, scale it up, so on and so forth? So this is actually a very, very critical piece. And if you haven't, spent time thinking about it, I would strongly encourage you, even as you're continuing to pursue your research and your solution design, is to go back and at least convince yourself that you have a well-articulated unmet needs statement. And by the way, I'm going to be doing something on December the 3rd, which is, like a pitch, how do you create a pitch deck? And I'm not going to repeat all of this, but a good pitch deck always starts with a clear, articulated unmet needs statement. That first slide then drives everything in your pitch deck and pulls it all together, right? It's almost like a summary table of contents, if you will. All right. So that's how I've got. That's all I've got. So thank you for this. So what is going to happen is we're actually recording this thing, so it's going to be up on our website, and I'm actually happy to put up the deck in PDF form on the website as well that you can download for your own reference. Okay, and again, feel free to reach out to us with other questions. We will have more announcements of webinars, in the future months ahead. Thank you again for coming. Thank you for taking the time and sharing with us. We are exactly at 1 o'clock. I hope you have the rest of a good day, and happy Thanksgiving. That's next week. Don't forget about that. Take care. Bye-bye.